Hi everyone. So I'm back today to talk about hot stone massage. I think this, to a certain extent, is kind of like the Marmite of the massage world. People either love it or hate it. Um, and certainly I have experienced it both as a therapist and as a client. Um, I I have to say I'm not a lover. Um, I can see that some people find it beneficial. For me personally, I think as a client, it just feels, while the heat is nice, um, the massage just feels very broken up. Um, 1 minute you've got heat there, and then it's not, because the therapist is, having to go to change the stones again. And in terms of sort of how relaxed I feel or how much I feel muscle tension is eased afterwards, I really didn't see any benefit personally. But everyone's different. Everyone likes different things. As a therapist, again, I don't like the fact that it is very broken up. A massage should be very fluid, and it's in making it that way that it actually can really, you know, improve sort of relaxation and ease stress. I quite often feel that when I've done a hot stones massage, I feel like I'm not really working the muscle, because obviously it's done with the stone, which, yes, you can give a firmer pressure, but to me, you just can't really get in there and feel, the sort of anatomical, things that you're feeling for. And certainly around the back and the shoulders as well, this is even more, the case, because the anatomy gets quite complex. You're dealing with smaller muscles, and you just can't get in there with a stone, and to me, I find that my clients' feedback, afterwards, in terms of certainly muscle tension, is really a lot more positive, when they've had my hands rather than the stones. But as I say, there are people out there that like it, and so it's really down to your own preference. I'd certainly say give it a go if you've not done already, and make your own mind up, really. So what is hot stones massage? Well, it uses basalt stones, which is basically volcanic rock, which have been heated in water to a specific temperature. And these stones are then used in the therapist's hands to massage specific points of the body. So they were actually used by Native Americans to relieve aching muscles, and they can be incorporated into, Swedish sports deep tissue massage, and the additional heat. The idea is that it allows quicker and deeper access to the muscles. Now, in my experience, I have found that the only time that I ever recommend a hot stones to a client is if I've had a client where either they are very, very sporty and they have a large muscle mass. So quite often, sometimes people like rugby players, or, serious like gym goers. I just find, if their muscles are at a point where even like the firmest sports massage that I can give, is not really making too much of a difference, just where the muscle is so tight, then I may, suggest hot stones, really just in an attempt to kind of give that muscle, warm it up and just make it a little easier to try and access those points that you need to get to. And likewise, I've had some clients that have medical issues, something like maybe spondylitis in the spine, or I've had a couple of clients where they've actually had spinal surgery that has not been successful, and consequently there's a huge amount of scar tissue, and there's really, their whole kind of spine is kind of almost frozen. There's no give in the muscle, and so again, sort of in clients like that where the massage is unlikely to make much of a difference in terms of the muscle tension, I will sometimes suggest hot stones, purely again just to add a bit of heat and, as a sort of a last resort to try and relax that muscle as much as possible. And obviously in cases like that as well, if the superficial muscles are excessively tight and there's no give, you've got no chance really of getting through to those deeper muscles. So sometimes, the hot stones, it may be that the heat will just kind of penetrate through those superficial muscles where maybe my hands can't, and in that way just help to relax those deeper muscles a little bit more. So the stones themselves come in all sorts of sizes. You could get one sort of as big as the palm of my hand, or you can get even just sort of, really small ones that some therapists even like use them between the toes, which I have to say personally, I don't see a huge benefit in, but again, every therapist is different and every client, likes different things. So the idea is that you use different size stones depending on what part of the body you are working on, depending on the build of your client, depending on what techniques you're using, because the idea is that the stones are used to mimic, those effleurage, kneading, friction techniques that I normally would be doing with my hands. Some therapists will also just place the stones along the meridians of the body to stimulate the movement of energy, and that's where you'll see sort of pictures of people having a massage where they just have a line of stones running along their spine, but certainly hot stones massage is something that should only be done by therapists who are experienced and qualified, in doing this type of massage. So in terms of benefits, again, numerous benefits that a lot of therapists would say they absolutely work. As I say, my personal opinion is that it doesn't really make a huge difference, but I will run through the benefits anyway, to give you guys a better understanding. So obviously we have things, again, as if you were working with your hands. It's said to reduce muscle stiffness, reduce any spasms in the muscle, and therefore can help to reduce chronic pain. It is thought to also promote deeper relaxation, and therefore sleeping patterns, and just reduce stress and anxiety, which obviously any massage will do that. It may also, certainly in your sort of more sportsy clients, it may also help to reduce trigger points, But again, it's going to be the same kind of principle as with massaging with your hands. So just in terms of sometimes just a static pressure is going to obviously work on those trigger points rather than a stretching motion. In terms of the circulation, obviously the heat will cause some vasodilation of the blood vessels, and therefore, i.e. it opens them up, boosting circulation, improving blood flow through the body, and also an impact on the immune system. It's thought that hot stones may relieve symptoms of autoimmune disorders, things like rheumatoid arthritis, fibromyalgia, and may just generally boost a person's immunity. Research has shown a reduced amount of something called arginine vasopressin, which is basically a hormone that regulates your blood pressure and also water retention. It may obviously help, just bring your blood pressure down as well. Also, it can help with, in terms of helping with the circulation, again, can assist in removal of toxins and helping to flush those through. But also there's an impact on the metabolism and the digestive system. It's thought, again, to boost metabolism, to relieve abdominal pain. We've talked about chronic pain, but so things like abdominal pain, cramping, bloating, constipation, diarrhea, again, these can all be eased, and certainly if you're cramping, the heat again can just relax those muscles, kind of like, if you've got really bad PMS and you have a hot water bottle, to try and relax those cramps. It's a similar kind of similar thing. So it is also thought, again, to improve skin appearance and as I say, replace them on the meridians of the body, so to improve energy flow also. And obviously, on a cold day, the extra warmth, it can be quite comforting as well. A lot of people like that. But as you can see, so a lot of these benefits are really things that actually you would get in a massage anyway, whether the stones are there or not. So it's really, to me, I think it's really just down to personal preference. I don't personally believe that the benefit is any different, but quite often it's how a client believes that therapy will work for them. So if you believe that it will do you some good, then more than likely it will do. But they are the benefits anyway. So how about the contraindications, the reasons why you as a client should not have a hot stone massage? Well, again, a lot of these, are going to be the same as if it was a normal massage being done with the therapist's hands. So in terms of the skin, so any areas where there's an open wound or skin burns, if you've had surgery in the last 6 weeks, and there's a fresh sort of wound site there, fractures, again, that will have broken the skin. Also skin conditions, so anything like eczema, psoriasis, and things that worsen with heat, hives. You're not going to want to have a hot stones massage, because actually it could make it worse, and really just irritate any open wounds. Also osteoporosis, which, to be honest, is usually contraindicated, even with normal massage, and certainly the extra pressure that comes from the stones really is a no-no for anyone with osteoporosis. In terms of the circulatory system, so anyone who has any kind of bleeding disorders, low platelets, anyone who is on anticoagulant therapy, so something like your warfarin, or if you've been, even if you've been in hospital and you've been having the enoxaparin or Clexane injections in your stomach, anything like that, you don't go with the hot stones. And that's again because obviously the heat is going to cause sort of extra dilatation, vasodilation of the blood vessels. So yeah, you don't want to kind of increase that if you're, on anticoagulant therapy or you've got some kind of bleeding issue. Likewise, a past history of blood clots, which again, with any kind of massage, that's going to be a bit of an issue. Varicose veins, common sense, you wouldn't apply pressure with any kind of massage over an area where there are varicose veins. You don't want to risk bursting that vein. Again, it comes down to the vasodilation of the blood vessels, not wise. If you've got varicose veins, high blood pressure, again, cardiac problems, all these things, just don't go with the hot stones, because it may well make the issue worse. Anyone who has anything, any condition where you may have numbness in an area, so sort of on the sort of basic end of the scale, that could be something like maybe a nerve compression due to a tight muscle. Sometimes that can cause numbness. But also things, more commonly things like multiple sclerosis, or in diabetic patients, if they've got diabetic neuropathy, they may have areas where there's loss of sensation, and obviously, any areas where, you can't kind of feel sensations so much, you're not really going to be wanting heat placed directly on that area, because, hopefully an experienced therapist shouldn't, they should know if the temperature is right of the stones, but you don't want to risk sort of suffering burns, because the stones were slightly too hot, or, and again, every client is different anyway. Some are going to be more sensitive to pain and heat than others. So yeah, best not to go with the hot stones if you have, areas of numbness. And also pregnancy, you should avoid hot stones. And if you take any kind of medication that again causes just the skin to be more sensitive than normal, so this could be things like antibiotics, it could be Accutane, which is acne medication, St. John's wort, people who take St. John's wort, you may well know that, you're more prone to sunburn. So it's kind of the same, concept, just you might be more sensitive to the heat of the stones. So yeah, so a lot of the contraindications again, very similar to as any normal massage. Now, some therapists actually also do a stone massage with cold stones, or something called contrast therapy, where the hot and cold stones are actually alternated. Now, I've not actually experienced this, the use of stones in this way, but I will just briefly run through, the sort of theory behind that method. So, the idea of contrast therapy is that you both dilate and constrict the blood vessels, which will then stimulate the blood flow and lymphatic drainage. So obviously the hot stones will cause vasodilation in the blood vessels, cause them to open up, improving the blood flow. And the cold stones will cause vasoconstriction. So the blood vessels will, sort of close back up a little bit. Just as that, your blood vessels would do, in a hot climate or then going into a cold climate. That's why, when you're cold, you shiver because, your blood vessels kind of close down to try and retain the heat, and, and then you get that shivering kick in. The cold stones can be used to just soothe and invigorate the skin, relieve hot flushes, in the menopause, or maybe to calm down engorged blood vessels, and relieve inflammation. If you've had maybe a sporting injury and the area is quite inflamed, it can be used just to kind of cool down that area. And again, the contraindications of cold stones, heart disease, high blood pressure, the circulatory problems that we've talked about, any areas of reduced sensation, or nerve damage, such as your diabetic neuropathy, your MS, and also abdominal discomfort, so pain, cramping, bloating, constipation, any of these bowel disorders may also be contraindicated. So, how successful that the cold stone treatment or the contrast therapy is, I can't really give you any more insight into that. Certainly I'd be interested to hear from anyone who has had that done, and whether they thought it was beneficial or not. But yeah, certainly, I'm not saying don't have a hot stone massage. I personally just don't see the benefits. But as I say, for some of you, you may think it's the best treatment you've ever had. So, but yeah, as I say, just if you have it done, please see someone who is qualified to do it, and enjoy it. So that's all for today on hot stones. And any questions, as always, you can contact me through my Facebook or Instagram pages. But for now, as far as the hot stones go, that is all from me. So I will see you next time. Okay.